So the DR-01 is a monoclonal antibody against the target CD94. It's in a very rare, ultra-rare subset of T-cell lymphomas called cytotoxic T-cell lymphomas. We had an oral presentation where we presented the first-in-human phase 1 and the phase 1 extension study data in this group of patients. Just by way of background, the cytotoxic T-cell lymphomas are about 3 to 6% of all T-cell lymphomas, very rare but very aggressive. The outcomes are very poor. The 1-year survival for hyperasplenic NK T-cell lymphoma and the measles, the monomorphic epitheliotropic intestinal T-cell lymphoma is less than a year. Relapse refractory extranodal NK T-cell is less than 3 months. So that's the background. But what unites these histologies is the expression of CD94. So it becomes a good target for this antibody, which works by connecting the Fc gamma receptors like CD16 to the CD94 and causes the lysis of the tumor cells, or through fratricide, because these are cytotoxic T cells. There are about 104 patients enrolled. We have 64 patients safety data. The safety data looks pretty good. It's a very well tolerated monoclonal antibody, except for infusion reactions, which are seen in the early cohort. It's sort of like a step-up dosing for bispecific. It has to be given once a week in the first month for the first 3 weeks, and then once a month thereafter. So the reactions that happen are usually the first or the second time around, but usually mitigated through supportive care. The evaluation happens at the beginning of the second cycle. And for the evaluable cohort, where we have about 48 patients. And the 48 patients, what we saw was the response rate is actually 42%. We had a dose, since it was a phase 1 study, we had dose levels 0.3 all the way to 10 mg per kilogram. And we saw response rates of 42% with 21% CR. In the 1 mg per kg group, we saw a CR of 54% with 29% CRs. So even though it's first in human study, rare subset, we're seeing responses, and they're also durable responses. We have about 4 patients who are beyond 1 year of therapy. One of my patients is post-allo. He's close to 2 years on therapy.